well aware, the pandemic has sidelined many parts of our lives, and one of those things are cancer clinical trials. That is a lifeline for many lung cancer patients. So much so, those clinical trials have led to more treatment breakthroughs in the last 5 years than in the previous 20 years. Joining us to talk a little bit more about it is Dr. David Carbone and Gina Hollenbeck. Good morning to you both. Thanks for being with us. Gina, I want to get to your really powerful story in just a moment, but Doctor, I'll begin with you. Why are these clinical trials so important to the treatment of lung cancer?
Well, good morning, Heather. Lung cancer has historically been a terrible disease with very short survivals and in the order of just a few months. But clinical trials over the last few years have resulted in bringing research from the laboratories into patients with dramatically improved survivals, whereas we could count survivals in months when I started treating lung cancer. Now we have many patients who are surviving years with metastatic lung cancer and even potentially cured of metastatic disease due to clinical trials, which were impacted by the COVID crisis dramatically with reduced accruals by over 70% a few months ago. But with increased protective equipment and rapid testing, we've been able to get those numbers almost back to normal so that patients today can have access to tomorrow's drugs through clinical trials.
And Gina, I can imagine that's been life-changing for you. Tell us your story.
Yeah, in 2015, I was diagnosed with stage 4 lung cancer. It had spread to my brain, and as a nurse, I was completely shocked that someone like me with absolutely no risk factors and honestly the picture of health could get lung cancers, but now could get lung cancer. But now I know that anyone with lungs can get lung cancer. I'm so thankful that I had a really smart doctor. He knew to look at the DNA of my cancer, which is called biomarker testing. And we found that I was eligible for targeted therapy, which is a little pill that I take instead of traditional IV chemo. And through these 5 years, I've had brain surgery and lung surgery, and I take daily targeted chemotherapy, but I'm able to live an amazing life because of these clinical trials and the participation that people have had. And even yesterday, I just ran 3 miles, and so I'm so thankful for all of the research that's being done. It's honestly the reason that I'm alive.
Wow. Wow. I'm so glad that you're doing better. It's giving hope for a lot of people. What would you tell somebody who's sitting at home watching right now, who's a little bit worried about taking part in a clinical trial, especially with COVID?
Well, the processes we've developed for clinical trials really protect patients very effectively. In my own clinic at the James in Columbus, we don't have a single case of transmission within the clinic. And so if we're careful, we use protective equipment, we do testing, I think patients are quite safe, and lung cancer is honestly a higher risk for them than the COVID.
Yeah, I would say that cancer doesn't stop for COVID, so I hope people will participate in clinical trials.
And if you're interested in taking part in a clinical trial, where would we go for more information on that?
Well, for patients, you can go to LCFA or lcfamerica.org, or you can text LCFA to 51555 to find out more information about participating in clinical trials during COVID.
Gina, thank you so much for sharing your story with us, and Doctor, for being with us this morning, giving a lot of hope to people out there, and hopefully hearing your message, they'll be signing up for these clinical trials, especially because you've talked about some of the safety measures that have been put in place. Thank you again.
Thank you, Heather.
Bye.
You're watching The Morning Blind. We'll be right back.
Mattress Firm's